Hello, everybody. So, welcome to World Schema Therapy Day for the UK. I'm just going to get a few bits of tech up and running before I start talking to you about what we're going to be doing today. So, I'm just going to, we're live streaming on YouTube in case we get lots and lots of people turning up today, more than the webinar can manage. So I'm just going to sort that out. Okay, I think that's our live stream going. And we're recording. And then I'm just going to get my presentation going. Okay, so let me share my screen. My webinar. Okay, great. I think I'm all sorted tech-wise now. So, welcome everybody to the UK Trek for World Schema Therapy Day. Welcome to those who are new to schema therapy and are coming to get a taster, and those who are already part of the schema community. My name is Dr. Jo White. I'm a clinical psychologist, advanced certified schema therapist, and supervisor and trainer. And I'm your host for today, so you're going to see a lot of me. And it's lovely to have you all here with us. So I'm really excited to share schema therapy with you guys today. I know there are many wonderful therapeutic models that we have available to us, but I believe that we have to find the model that fits for us. A model that inspires us, that challenges us, and supports us to become the best psychologists, therapists, coaches that we can be. And schema therapy is that model for me. I trained back in 2017 and I've pretty much lived and breathed it since then. And I hope that today gives you a chance to get a flavour of schema therapy to see if it might be a model that fits for you too. So how did this day come about? So there's a group of us that started to meet earlier this year to think about how we can share schema therapy more widely in the UK. And the ISST, so the International Society for Schema Therapy, started to offered us the opportunity to get involved in World Schema Therapy Day. And we thought this sort of started off as a small idea. Maybe we would promote what's already been provided by the ISST, but very generous offers came flooding in from other presenters, and we've ended up with a full day's programme just for the UK, which is what you're joining us for now. And I'm so grateful for all of the generous contributions from our presenters and panelists and everybody who has worked with me to get this day up and running. We've got over 1,000 people signed up, which is an amazing response. I'm so pleased with that. And let's have a bit of a look at the programme for today. So what we're going to be looking at together, watching together. So first off, you've got what is schema therapy. So I'm going to give you a brief overview of what schema therapy is. And then Jill is going to join me, Jill Heath is going to join me to provide you a short sort of snapshot of some of the research into schema therapy and the effectiveness. Then at 9:50, there's going to be a presentation from Jill and Helen Startup about the inner critic mode. Then at 11:20, we're going to go for a break. So we're going to have 15 minutes break at that point. 11:35, Kate Williams and me are going to provide an introduction to chair work. Then we're going to have 30 minutes for lunch at 1 o'clock. And after lunch, we've got Tara Cutland-Green and Louise Coates joining us for a session on imagery in schema therapy. Then at 2:30, strengthening the healthy adult with Yanis Predis and Helen Startup. Then another break before we go into the final session of the day, which is our panel discussion, where we're going to be thinking about applications of schema therapy. And I've got Jill and Rob Seismanik, Beatrice N.G. Kessler and Louise Coates joining us to share their perspectives and reflections on schema therapy and its applications before we close at 4:45, and we'll be all done by 5 o'clock. So we've got a full day here for you. And so to say a bit more about World Schema Therapy Day, so it is called World Schema Therapy Day because there is an international programme that's taking place. You can sign up to World Schema Therapy Day using this event link here, or have a look on the ISST website. If you Google World Schema Therapy Day in ISST, then that will take you to the right page. If you sign up, then the ISST are offering a reduction on joining the Schema Therapy Society, I think for 7 or 14 days, something like that. You can get the reduction. But there's also international tracks for all of these different topics. So on the ISST YouTube channel, you can also follow a track for individual schema therapy. There's a track specifically for couples schema therapy. There's one for child and adolescent schema therapy and for group schema therapy. So there's loads and loads of brilliant presentations that you can access if you want to learn more about schema therapy after our programme today. So a bit about today. The presentations are designed to introduce you to schema therapy and explore schema therapy ideas rather than provide you with any formal clinical training. So the aim is to give you an overview of the model and a sense of how it can be applied in practice, but it isn't a substitute for certified schema therapy training or individual clinical guidance. We'll be touching on some therapeutic themes and personal reflections, so please look after yourself as you go. You're welcome to step away, to pause, to take a few breaths if anything feels emotionally activating for you or resonates more personally than you expect. We all know that learning about these concepts can sometimes bring up our own material, so please just engage in a way that feels safe and comfortable for you. Okay, so let me just take a drink. And we're going to go straight into our introduction to schema therapy. Dylan, are you able to? So in the background, I've got Dylan and Usaria who are helping me to host the event today. They'll be keeping a track of the Q&A, so please do put questions into the Q&A. We will get some points throughout the day to be able to answer some of your questions. There's also a Dropbox file which has got the majority of the slides for today's sessions. So I think Dylan is going to post the link to the Dropbox file for you all so that you can download the slides and use those as you're following the sessions today. Okay, so please do feel free to put your questions in the Q&A option at the bottom of Zoom. Okay, so I'm going to give you an introduction to schema therapy now. I've got half an hour. I mean, this could be a whole day's session. So I will give you a brief overview of the model. We'll touch on how to understand schemas and modes and some of the clinical applications of schema therapy. Okay, so I'm going to do a little poll here. So I'm interested in how familiar you are with schema therapy. So all the answers are coming in. Great, thank you. So sharing those results. So a small number of you are brand new to this. 43% have heard of it, 35% some training, and 17% use regularly. Great, thank you for sharing that. So hopefully lots of information for those of you that haven't heard of it before, or getting your head around the model, and a good refresher for those of you that have done some training and are using schema therapy really regularly. So what is schema therapy? So it's a model that was developed by Jeffrey Young and his colleagues. And it's a combination of both a theoretical model and a structured intervention. The model is an integrative model, so it's a combination of what we know and find really helpful from cognitive behavioral therapy, attachment theory, Gestalt, object relations, and psychoanalytic ideas. So it's an integration of all of those different perspectives. And the theoretical model is made up of schemas, which are deep patterns from unmet emotional needs. So these are unmet needs that we anticipate are unmet within primary attachments. So primarily we think about schemas developing in children, and thinking about their primary attachments and how much safety, stability, nurturing and validation took place within those attachments. And when those emotional needs are not met on a regular basis, then schemas develop. Modes are how the schemas come alive in the individual. So they're the moment-to-moment emotional states when the schemas are activated. And then we have this structured intervention that helps us to put the theory into practice with our clients. And that involves experiential techniques, so imagery and chair work. These techniques allow us to sort of work in the emotions, within the difficulties, rather than just talking about problems. So of course, there's some talking about that we do in schema therapy, but there's a real emphasis on experiential work where we can work actively within the challenges that somebody's bringing to therapy. There are cognitive and behavioural techniques, which I'm sure many of you will be very familiar with. And there's a particular relational stance, which is called limited reparenting. And within this relational stance in therapy, our limited reparenting, we're working on the unmet emotional needs via the relationship between the therapist and the client. So we're working on trying to meet those unmet needs within our therapeutic relationship. Okay, so what are schemas? So a little bit more about what schemas are. So maladaptive schemas are a framework through which individuals organise and make sense of experiences, relationships, and the world. So it's like putting on a pair of glasses that influence the way that we interpret everything. They're based on past experiences where the individual's emotional needs have not been met repeatedly, and the schema made sense considering their experiences. So this isn't, schemas don't occur from sort of one or two situations where needs haven't been met. It's about this repeated experience where emotional needs aren't met. And so the schema kind of makes sense within that individual's experiences, considering their experiences. It makes sense for them to fear being abandoned, for example. And so the schema is a broad and pervasive theme or pattern, and it comprises of 4 elements: memories that relate to that schematic belief and that network, emotions, cognitions, and bodily sensations. So that's a bit of a description of what schemas are. And here are the 18 schemas that Jeff Young identified. Just give you a few moments to have a look through those. So these are all the themes that Jeff Young and his colleagues identified and organised into schemas. And so let's think through a couple of examples of schemas. So one of the schemas is the abandonment and instability schema. And so this is the perceived instability or unreliability of significant others to be present for and provide support, connection, strength, or protection. The individual may fear that others will die imminently or abandon the individual for someone else. And so in this example with Maria, who's 32, becomes extremely anxious whenever her partner doesn't reply to messages. She fears he's losing interest and will eventually leave her like her father did when she was a child. So that's an example of one of the schemas. Let's have a look at how that abandonment schema shows up for Maria. So there's a key cognition. People I love will always leave me. There's key memories that connect into this. And just thinking about the memories, sometimes something so severe happens, sort of a big T trauma happens, and that might be sufficient to develop a schema, but oftentimes it's about multiple smaller events that aren't managed emotionally with the child that lead to the schema developing. And so the key memory here from Maria for her abandonment schema, maybe this is sufficient if Maria wasn't supported to manage it, but remembering her father packing his bags and leaving home when she was 7. And the feelings that come up for Maria around panic, sadness, helplessness, and longing, with body sensations of a tight chest, racing heart, and trembling hands. So that's Maria's abandonment schema. Oh, sorry, it's too fast there. And then another of the 18 schemas is called the mistrust and abuse schema. So this is the expectation that others will intentionally hurt, abuse, humiliate, cheat, or take advantage of the individual. Harm is usually perceived to be intentional or the result of unjustified and extreme negligence. So in this example, Jamal, 28, struggles to open up to new friends. He assumes they'll betray him like his older brother, who used to mock and humiliate him in front of his friends. And just thinking about how Jamal's mistrust schema shows up. So the key cognition here is if I trust people, they'll hurt or humiliate me. Key memory, recalling his brother laughing at him in front of his classmates when he cried after being teased. The feelings that Jamal experiences when his mistrust schema is activated: anger, fear, shame, vigilance, with body sensations of a tight jaw, clenched fists, stomach tension, and hyper alertness. Okay, so I just want you to take a moment to think of a time recently when you felt some tricky emotions. So don't go for something that made you feel really overwhelmed, something kind of middly, that you notice the emotions and feeling a bit unsettled by them. What story did your mind tell you about yourself in that moment? How did you feel? Does this connect to any memories of similar experiences? You know, is there a thread of this experience linking back into the past? And how did your body respond? So this is an example of one of your schemas probably being activated. So you get a sense of the different elements of that experience. Perhaps there's a theme there for you. Okay, so just taking a big breath and a slow out breath and letting that memory fade. Okay. And now let's have a think about how schemas link with modes. So the mode model was developed because Jeff Young identified that many of the people that he worked with, there were multiple schemas that were being activated. So it wasn't just the abandonment schema or mistrust and abuse schema that's being activated for somebody, but actually multiple different schemas, maybe 5 or 6 that are being activated at one time. And so the mode model allows us to think about how multiple schemas can link into the way the person is presenting in that moment. So schema modes are like the moment-to-moment emotional states or parts of the individual. For example, a client might come into a therapy session with me and at first appear quite sort of emotionless and flat. And then maybe they'll shift into feeling very sad and overwhelmed by their emotions. And then they might shift into being very self-critical, and then back to being kind of flat and emotionally cut off again. So in schema therapy, we'd call this mode flipping, kind of shifting between different emotional states. It's how an individual behaves, relates to themselves, or copes when their schemas are activated. So when a schema is activated, we might express our vulnerability and our emotions. We might become very self-critical, or we might work really, really hard not to feel emotions. And so these are all schema modes. So there are different types of schema modes. And arguably the most important mode is the vulnerable child mode. This is the part that feels all of the vulnerable emotions when the schemas are activated. So it's the emotions that arise when our needs are not being met. And in schema therapy, we teach our clients to look after that mode, to look after the vulnerable child and try and get the vulnerable child's needs met. So using that example of Maria, who had a very strong abandonment schema, when Maria is in her vulnerable child mode, she feels scared, sad, and desperate for reassurance. She thinks, please don't leave me. Physically, she has a tight chest. She might be trembling. She might be tearful. And she's showing her kind of deep fear of being alone. So this is the vulnerable child mode. And I'm sure you'll hear lots more about this mode throughout the day. And a second type of modes are the critic modes. So this is like the inner chatter, repeating messages that are internalized from childhood. The messages can be critical, punishing, demanding, pressurizing, and guilt-inducing. And in schema therapy, we aim to kind of externalize this critic mode and to turn the volume down on it. The critic mode really steps in and focuses on criticizing needs and emotions. So often when the vulnerable child pops up, then the critic mode is there, kind of attacking the vulnerable child for having the emotions and the needs that it has. So when Maria's critic mode is strong, she blames herself for being too needy or not good enough. Her inner voice is harsh and shaming. It's like, no wonder people leave you. You're pathetic. She feels guilt, self-disgust, and tension in her body. A third type of mode are the coping modes. So these are the survival responses that help manage schema activation, involving avoidance, surrender, and overcompensation. And the coping modes, they perpetuate the schemas because they tend to block the vulnerable child from getting their needs met. They worked really well in the past when the person was little, when they were going through these difficult events within their life, within their attachment relationships. These survival strategies were necessary, but as adults now, the survival strategies are getting in the way. They're stopping that person from getting their needs met. And so Maria copes with her fear of abandonment by either clinging to others, completely shutting down, or by acting overly independent. So you can see how those things were linked to her abandonment schema. And so these modes help her to avoid the pain of abandonment, but actually they end up keeping her feeling alone and unseen. And then we have the healthy modes. So the fourth type of modes are the healthy modes, which include the healthy adult mode. And the healthy adult mode connects and meets the needs of the vulnerable child mode through nurture and protection. It's a mode that can balance the needs of the self and other people and is able to demonstrate much more flexible coping and self-awareness. And so when Maria is in her healthy adult mode, she can soothe her fears and respond with balance and self-compassion. And she reminds herself that her partner not replying doesn't mean that she'll be abandoned. Okay, so taking another moment of reflection and just bringing to mind that same triggering moment again that you were thinking about earlier. What part of you shows up? How did that schema come to life for you? Was it a vulnerable side that felt and connected with strong emotions? Was it a very critical side or pressuring side? Just noticing the tone of the messages that were in your mind. Or was it a coping mode there to try and help you to move away from the feelings or move away from the critical messages? And maybe you notice a couple of different modes and how you shifted from one mode to another. So this is how modes are showing up for us. And it's our response to our schemas being activated. Okay, taking another breath. Letting that go. Okay. So thinking about the aims of schema therapy. So one of our primary aims is to connect to core emotional needs. So we're aiming to help our clients to understand what emotional needs are and how to meet them. And I know in the session this afternoon with Tara and Louise, they talk in much more detail about emotional needs. So they'll give you an overview of emotional needs in their session. And I find that many people have never thought about what they need, what their emotional needs are. They may not even have occurred to them that they have emotional needs. But when our needs are met in relationships and in our lives, we can grow, we can move forwards, we can feel connected, and we're much more able to process difficult events that happen. And so you'll hear me in therapy sessions often saying, what do you need? What is it that you need right now? Helping people to become aware of those needs and connect to them. We're also aiming to support schema healing. So schema healing is about processing the events that led to the schemas developing. So for example, if somebody has had a traumatic childhood, they may have been given messages that led them to believe that those traumatic events that happened were all their fault. They deserved those events happening, they are to blame. And so they might have developed a defectiveness schema, defectiveness shame schema. As a result, that defectiveness schema shows up in the present and they blame themselves for the things that happen in the present, which leaves them vulnerable in relationships because they don't know how to protect themselves and recognize actually what's theirs, what's somebody else's. And so they end up experiencing further traumatic events and then further on blaming themselves even more. And so we aim to heal the schemas to give people different perspectives on the early events that happened to them, actually how their needs should have been met, recognizing that these situations weren't their fault, healing that defectiveness schema so they don't automatically assume in the present that they're to blame when something goes wrong. We're also looking to reverse maladaptive coping responses. So that's thinking about those coping modes. So we know that our coping modes perpetuate the schemas. They stop us from getting our needs met. So we're trying to help people to step away from those coping modes, to not use them in such a rigid manner. So for example, I have lots of people who come to me who never received any care and nurturing and empathy as a child. And so when it comes to them feeling distress in the present, they tend not to show other people or communicate to other people about the stress they're feeling, because they worry that nobody will care about it. Because of those experiences in the past, they assume that people in the present are not going to care that they're distressed. And so it's easier to just not show that distress to other people, so that they don't feel the pain of people not caring in the present. But of course, that also means that they're stuck in a position where they're never going to receive care in the present either. So we're trying to help people step away from those coping modes. And we're also working on building the healthy adult. So the part that can tune into needs and find ways of meeting them, that can balance the individual's needs with the needs of other people. So those are the broad aims of schema therapy. And then thinking about who is schema therapy for. So schema therapy is a transdiagnostic model. So it's focusing on underlying patterns of thoughts and emotions and unmet needs rather than specific symptoms. So we're able to apply it across different mental health needs. It's aimed at chronic and complex difficulties. So as you know, as I talked about earlier, Jeff Young was finding that CBT wasn't working at a sufficient depth to shift the difficulties of the people that were coming to him, the people with more chronic and complex difficulties. And so he developed schema therapy to work exactly with this group. Often there's been significant attachment-based trauma. So traumatic events that have happened within those attachment relationships that are supposed to feel safe and nurturing. And schema therapy is aimed at tackling long-standing patterns of challenges relating to the self and in relationships with others. So also known as personality disorder. Personally, I don't like the term personality disorder. It's not a category that I sort of use or align with, and I know that stands for many people joining today as presenters. However, if you read the schema therapy literature, this is a term that you'll come across because the model was developed to address these long-standing patterns of relating to self and others. And so research is based around diagnostic categories as a means of grouping different patterns of struggles and to look at the effectiveness of schema therapy. And Jill and I are going to talk in a moment about some of the research evidence relating to schema therapy. We are doing a very quick overview of some of the research, but on the main ISST program, then you will find an hour's session on the research evidence for schema therapy. So if you'd like to read more about that, to understand more about that, then please do go over to the ISST YouTube channel over the next few weeks and have a look at that session that's focused on the research, because that will give you much more detail than we've had time to do today. Okay, Dylan, are you able to spotlight Jill so she can join me as well? Hello, Jill.
Hello, Jo. Thank you for that wonderful presentation. Just really schema therapy in a nutshell, really inspiring. Thank you.
Oh, no, thank you, Jill. Right, I'm going to share your next slide. Thank you for coming and joining me.
My pleasure.
This element of the session this morning.
So, hello, everybody. I'm going to give you a brief overview of the quantitative evidence base for schema therapy to date, and then Jo is going to dive into the qualitative research. So I also don't align with the term personality disorder. I find it pejorative and reductive. However, most of the large scale studies into schema therapy have been done with clients who've been given a diagnosis of personality disorder. And there are 4 particularly important randomized controlled trials which have demonstrated superior outcomes for patients with diagnoses of BPD, cluster C, which is your fearful and avoidant group, narcissistic, paranoid, and histrionic personality disorder, as well as violent offenders with personality disorder diagnoses. So if you look at this overall, these studies cover a wide range of complex, severe, and enduring presentations. And in these randomized controlled trials, schema therapy did better across the board compared to the comparator treatment. So this is on multiple outcomes, including recovery from the primary diagnosis, in terms of symptom reductions, improvements in general functioning, improved well-being, and importantly, having lower dropout. The clients in the schema therapy group tended to stay more consistently than in the comparator group. So thinking about the systemic reviews into schema therapy, and so far there have been 6 looking at schema therapy's impact across the board with different kinds of problems. And there's also been 1 meta-analysis of the data that we have so far. And these systemic reviews have all concluded that schema therapy is an effective treatment for PD with moderate effect sizes in reducing symptoms and maladaptive schemas. Can we have the next slide, please?
Of course.
So what about other problems? Systemic reviews have also concluded that there is preliminary and promising support for schema therapy with a range of anxiety disorders. So this includes agoraphobia, generalized anxiety disorder, OCD, and PTSD. And eating disorders, especially for those experiencing more severe and enduring eating disorders. There's also evidence from an RCT comparing schema therapy for CBT for depression, which showed equal efficacy across the 2 groups. And in this randomized controlled trial, this was about a 50% reduction in symptoms for both groups. So that suggests promise for schema therapy as a possible option for some clients with depression. Now looking at a more process level, with BPD, schema therapy has been shown to be associated with greater therapeutic alliance. And here, alliance predicted outcome. So that supports the importance of the therapy relationship for this patient group at least. And finally, there's also support for the efficacy of imagery rescripting in the treatment of childhood trauma. And there's qualitative evidence that chair work has benefits for those with a BPD diagnosis. And I think Joe's going to speak to that study in a minute. It's important to step back a little bit here, because often I find them when Tara and I are running training, people ask us, well, what does that mean in terms of when and where you might choose to use schema therapy? And I think, one reason you might consider schema therapy is when your client might have been struggling with a mix of these different issues for which there is evidence. So personality disorder issues, i.e. kind of entrenched difficulties relating to the self and interpersonal difficulties, complex trauma, that kind of presentation. And maybe the client also might have other issues mixed in to do with anxiety, to do with depression or eating disorders issues, body image issues, that kind of thing. And you might be looking for a model where you can have a truly integrated and unified treatment to make sense of and help with all these different elements coming up for them. And then schema therapy might be something that you might want to consider. Okay, Joe, over to you.
Thanks, Jill. Thank you. Okay, I was really glad that Jill offered to come and help me with this bit on research, because her understanding of research trials is so much better than mine. But the thing that I really love about research is often the qualitative research, because it gives you a real sense, doesn't it, of people's experiences. So that's what I'm going to talk about now.
Absolutely.
So a couple of, gosh, there were so many different nuggets from the qualitative research that I could have chosen, but obviously we have a limited amount of time. So I just pulled on 4 different studies. So therapists and patients agreed that high commitment in the therapeutic relationship, which I think is something that Jill talked about in terms of predicting outcomes, having a transparent theoretical model, so a model that we're sharing between ourselves and our clients, and using specific schema therapy techniques were amongst the most helpful aspects of schema therapy. Patients find chair work emotionally demanding and exhausting in the short term, but reported positive changes in the long term. So chair work helped them to understand the mode model, reduce the punitive critic, and increase the healthy adult mode. Patients experience greater self-acceptance, improved ability to cope with emotional needs, and improvements in interpersonal relationships. So obviously these are much smaller studies and qualitative studies around patients and therapists' perspectives. And I think that's something that I definitely notice in terms of the emotional demand of the work that we're doing, because we're working within the emotions in chair work and imagery exercises. It is really tiring for our clients, also tiring as a therapist to be doing that work because it requires a lot from us emotionally, but the long-term outcomes of that are positive. And then another couple of extracts. So patients said that schema therapy increased their self-understanding, their emotional awareness, and ability to manage emotions. Some techniques, especially the experiential ones, were emotionally confronting, but many felt they were necessary. And participants find imagery rescripting intense and sometimes overwhelming. It led to a better understanding of themselves, of their schemas, recognizing how past events shaped their beliefs and reactions. Participants reported better emotional control and healthier relationships. They could tolerate and express feelings more calmly, react less impulsively, and trust others more. They also felt more stable and self-compassionate, showing greater kindness, understanding, and forgiveness towards themselves. So a couple of areas where the research has sort of stood out to me. Okay, so that's the end of my introduction. Thank you, Jill, for your contributions to that. So we've probably, let me just stop my share. I wonder if there's just one question. Probably only got time for one. Is there anything that's come up, Dylan or Nusaria, for me to answer?
Yes, there's a couple of questions. One of them is, I work in a children in care CAMS team where there is significant attachment difficulties and abuse trauma in the history. I'd be curious to hear about the application with this community of children.
Mm-hmm. So this will be a topic for the track focused on children and adolescents. So I would suggest definitely going across to the ISST YouTube channel and tapping into to that track. I mean, certainly there are many people who come to schema therapy as adults who've experienced this level of sort of significant attachment trauma and attachment disruption. And I think the research is showing, effectiveness in terms of working with these severe attachment levels. I don't know whether there's things particularly around people who've been in care. That would be something that's really worth looking into in terms of whether there's research there existing already. But the model certainly would allow you to formulate and understand the schemas that develop from such significant attachment issues. So